Question 1. A patient presents with chronic obstructive pulmonary disease with acute exacerbation. How is this typically coded in ICD-10-CM? A. J44.1, J44.0. B. J44.0, J44.1. C. J44.9, J44.1. D. J44.1 only. Answer: D. J44.1 only. This question tests your knowledge of combination codes in ICD-10-CM. The key phrase, with acute exacerbation, indicates that the condition has worsened temporarily. In ICD-10-CM, J44.1 is a combination code that captures both chronic obstructive pulmonary disease and the acute exacerbation, meaning you only need this single code. Using two separate codes would be incorrect as the combination code exists for this specific relationship. Remember, always look for combination codes when multiple conditions are described as linked, like with, due to, or associated with. Question 2. What is the CPT code range for evaluation and management, E/M, services? A. 0010001999. B. 10,021 to 69,990. C. 70,010 to 79,999. D. 99,202 to 99,499. Answer: D. 99,202 to 99,499. This question asks about the CPT code range for E/M services, which are some of the most frequently used codes. E/M codes describe physician encounters such as office visits, hospital visits, and consultations. The codes 00100-01999 are anesthesia, 10,021 to 69,990 are surgery, and 70,010 to 79,999 are radiology. Recognizing the distinct sections and code ranges in the CPT manual is crucial for navigating it efficiently. Make sure to familiarize yourself with the main sections and their corresponding code ranges in the CPT book. Question 3. A patient is seen for follow-up care after a completed course of treatment for a malignant neoplasm of the lung. There is no evidence of recurrence. What is the appropriate status code? A. Z85.221. B. C34.90. C. Z86.010. D. Z85.3. Answer: A. Z85.221. This question focuses on coding for personal history of malignancy in ICD-10-CM. The phrase, after a completed course of treatment and no evidence of recurrence, are key clues indicating the patient is no longer actively being treated for the cancer but has a history of it. Z codes are used for factors influencing health status and contact with health services, including personal history codes. Z85.221 specifically represents a personal history of malignant neoplasm of the trachea, bronchus, and lung. Active cancer codes, like C34.90, are not used once treatment is complete and there's no recurrence, while other Z codes relate to different histories or factors. Always use a personal history code when the primary malignancy has been eradicated and is no longer being treated. Question 4. Which part of the CPT manual provides a list of modifiers? A. Appendix A. B. Appendix B. C. Appendix C. D. Appendix D. Answer: A. Appendix A. This question tests your familiarity with the appendices of the CPT manual. Modifiers are crucial two-digit codes added to CPT codes to provide additional information about the service performed. Appendix A is specifically designated to list all approved CPT modifiers and their descriptions. Appendix B lists annual code changes, Appendix C contains clinical examples, and Appendix D lists deleted CPT codes. Knowing where to find important information like modifiers in the CPT manual saves you time during coding. Question 5. What is the medical term for inflammation of the liver? A. Nephritis. B. Gastritis. C. Hepatitis. D. Arthritis. Answer: C. Hepatitis. This question tests basic medical terminology, specifically focusing on root words and suffixes related to inflammation. The suffix itis commonly indicates inflammation. The root word for liver is hepat/o. Combining hepat/o with itis gives you hepatitis, meaning inflammation of the liver. Nephritis is kidney inflammation, gastritis is stomach inflammation, and arthritis is joint inflammation. Understanding common medical root words, prefixes, and suffixes is fundamental to understanding documentation and selecting correct codes. Question 6. A patient undergoes an appendectomy, surgical removal of the appendix. Which CPT code section would you look in? A. Medicine. B. Radiology. C. Surgery. D. Evaluation and management. Answer: C. Surgery. This question asks about the correct section in the CPT manual for a surgical procedure. An appendectomy is a procedure involving the removal of an organ via incision or minimally invasive technique. The surgery section of the CPT manual, codes 10,021 to 69,990, is where you will find codes for surgical procedures performed on various body systems, including the digestive system, which includes the appendix. Medicine codes are for non-surgical services, radiology is for imaging, and E/M is for office visits and similar encounters. When looking for a procedural code, identify the type of procedure and the body system involved to navigate to the correct CPT section. Question 7. What is the primary purpose of HCPCS Level II codes? A. To report physician services and procedures. B. To report durable medical equipment, prosthetics, orthotics, and supplies, DMEPOs. C. To report inpatient hospital services. D. To report diagnoses. Answer: B. To report durable medical equipment, prosthetics, orthotics, and supplies, DMEPOs. This question tests your understanding of the different coding systems used in healthcare. HCPCS Level II codes, also known as national codes, are used to report products, supplies, and services not included in CPT, such as ambulance services, durable medical equipment, like wheelchairs or oxygen tanks, and certain drugs. CPT codes, Level 1, report physician services and procedures, ICD-10-CM codes report diagnoses, and hospital inpatient services use a combination of ICD-10-CM/PCS. Remember that HCPCS Level II fills the gaps left by CPT for reporting non-physician services and supplies, which is important for proper billing. Question 8. According to CPT guidelines, what is required documentation for reporting services based on time? A. The medical necessity for the visit. B. The start and end time of the encounter or the total time spent. C. A list of all procedures performed. D. The patient's chief complaint. Answer B. The start and end time of the encounter or the total time spent. This question focuses on the specific documentation requirements for E/M services coded based on time. For certain E/M codes, especially those related to time, like counseling or coordination of care dominating the visit, CPT guidelines require explicit documentation of the time spent. You need to record the total time face-to-face with the patient or the unit/floor time, depending on the code. While medical necessity, procedures, and chief complaint are essential parts of the medical record, they are not the specific requirement for coding based on time. Always check the E/M guidelines in your CPT manual for the specific time-based coding rules. Question 9. What is the anatomical term for the plane that divides the body into anterior, front, and posterior, back, portions? A. Sagittal plane. B. Transverse plane. C. Frontal, coronal, plane. D. Median plane. Answer C. Frontal, coronal, plane. This question tests your knowledge of anatomical planes, which are imaginary flat surfaces used to divide the body or organs. The frontal plane, also known as the coronal plane, specifically divides the body into front, anterior, and back, posterior, sections. The sagittal plane divides the body into left and right portions, and the transverse plane divides the body into upper, superior, and lower, inferior, portions. Understanding anatomical terms and planes is fundamental for accurately interpreting medical documentation. Question 10. A coder is unsure which of two ICD-10-CM codes is most appropriate for a patient's condition. What is the best course of action? A. Ask the patient which code they prefer. B. Assign both codes. C. Query the physician for clarification. D. Randomly select one of the codes. Answer C. Query the physician for clarification. This question addresses a common scenario in coding practice when documentation is unclear or conflicting. If a coder is unsure which code best represents the patient's condition based on the available documentation, the ethical and correct procedure is to query the physician. The physician is the only one who can provide clarification or additional information about the patient's diagnosis or the services provided. Assigning both codes or randomly selecting a code without clarification would be incorrect coding practice. Always query the provider when the documentation is ambiguous or insufficient for accurate coding. Question 11. What is the definition of a principal diagnosis in the inpatient setting according to ICD-10-CM guidelines? A. The condition that is the least severe among all diagnoses. B. The condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. C. Any condition treated during the hospital stay. D. The condition listed first by the physician. Answer B. The condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. This question tests your understanding of principal diagnosis selection in the inpatient setting, which is a core concept in ICD-10-CM coding for hospitals. The principal diagnosis is not simply the first one listed or the most severe, it is the condition, determined after the patient's stay has been studied, that was the primary reason for their admission. This definition is crucial for accurate reporting of inpatient services. Always refer to Section 2 of the ICD-10-CM guidelines for the specific rules on selecting the principal diagnosis. Question 12. Which of the following is an example of a HCPCS Level II modifier? A. -25. B. RT. C. TC. D. All of the above. Answer: D. All of the above. This question asks you to identify HCPCS Level II modifiers. HCPCS Level II uses modifiers to provide additional information, just like CPT modifiers. While -25 is a common CPT modifier indicating a significant, separately identifiable E/M service, RT, right side, and TC, technical component, are examples of modifiers that can be used with both CPT and HCPCS Level II codes, but are often associated with HCPCS Level II, particularly for reporting things like supplies or technical services. HCPCS Level II has its own set of modifiers in addition to utilizing some CPT modifiers. Familiarize yourself with common HCPCS Level II modifiers, which often relate to anatomical sites or specific service components. Question 13. When coding a biopsy followed by a definitive surgical procedure on the same lesion, how are the CPT codes typically reported? A. Only the biopsy code is reported. B. Only the definitive surgical procedure code is reported. C. Both the biopsy and the definitive procedure codes are reported. D. Neither code is reported if performed on the same day. Answer: B. Only the definitive surgical procedure code is reported. This question tests a specific CPT coding guideline related to biopsies and subsequent definitive procedures. According to CPT rules, if a biopsy is performed on a lesion and is immediately followed by a more extensive or definitive surgical procedure on the same lesion during the same encounter, the biopsy is considered an integral part of the definitive procedure and is typically not coded separately. The definitive procedure code includes the work of the biopsy. This prevents double-dipping for the same service. The definitive procedure code represents the total service provided for that lesion. Question 14. A patient is diagnosed with type 2 diabetes mellitus with diabetic neuropathy. How is this coded in ICD-10-CM? A. E11.40. B. G63.5, E11.9. C. E11.40, G63.5. D. E11.9, G63.5. Answer: A. E11.40. This question focuses on coding diabetes mellitus with complications in ICD-10-CM. When diabetes is documented with a related complication, such as neuropathy, you should look for a combination code that includes both the diabetes type and the specific complication. E11.40 is the combination code for type 2 diabetes mellitus with diabetic neuropathy. Coding the diabetes and neuropathy separately, E11.9 and G63.5, is incorrect when a combination code exists. Always check the ICD-10-CM index and tabular list for combination codes when coding diabetes with documented complications. Question 15. What is the anatomical term for the region of the body located towards the side, away from the midline? A. Medial. B. Lateral. C. Proximal. D. Distal. Answer: B. Lateral. This question tests your understanding of directional terms used in anatomy. Lateral means situated at the side, away from the midline of the body. Medial means towards the midline, proximal means closer to the point of origin or attachment, and distal means further away from the point of origin or attachment. For example, the arms are lateral to the chest. Mastering these directional terms is essential for accurately interpreting anatomical locations described in medical reports. Question 16. A physician performs a comprehensive history, a comprehensive examination, and has medical decision-making of moderate complexity for a new patient office visit. Which level of E/M service is supported? A. 99,202. B. 99,203. C. 92,204. D. 99,205. Answer: D. 99205. This question tests your ability to determine the appropriate E/M code based on the key components of the visit for a new patient. For new patients, all three key components, history, examination, and medical decision-making, must meet or exceed the level defined in the code description. A comprehensive history, comprehensive examination, and moderate medical decision-making support a Level 4 new patient office visit, which is represented by code 99205 in the older E/M guidelines. Note that while 2021 E/M guidelines changed for office visits focusing on time or MDM, understanding the traditional components is still important for some exam questions or other E/M categories. Always consult the current E/M guidelines for the specific category you are coding. Question 17. Which coding system is used to report inpatient hospital procedures? A. CPT. B. HCPCS Level II. C. ICD-10-PCS. D. ICD-10-CM. Answer: C. ICD-10-PCS. This question asks about the coding system used for inpatient procedures in hospitals. ICD-10-PCS, Procedure Coding System, is the standard used in the United States for coding procedures performed in the inpatient hospital setting. CPT is used for outpatient procedures and physician services, both inpatient and outpatient. HCPCS Level II is for supplies and non-physician services, and ICD-10-CM is for diagnoses in all settings. Remember that ICD-10-PCS is specific to inpatient hospital procedures and has a unique structure compared to CPT. Question 18. A patient receives an injection of a drug. The drug itself is reported using which coding system? A. CPT. B. ICD-10-CM. C. ICD-10-PCS. D. HCPCS Level II. Answer: D. HCPCS Level II. This question focuses on reporting the substance administered, not just the administration service. While the CPT code range 90,000 to 99,999 includes codes for therapeutic procedures like injections, the specific drug or biological agent injected is often reported using a HCPCS Level II code, J code or similar. ICD-10-CM is for diagnoses, and ICD-10-PCS is for inpatient procedures. Remember that HCPCS Level II is used to report supplies and drugs administered in an outpatient setting. Question 19. According to ICD-10-CM guidelines, if a patient has both an acute and a chronic condition, and separate codes exist, how should they be reported? A. Only the acute code is reported. B. Only the chronic code is reported. C. Both acute and chronic codes are reported, with the acute code sequenced first. D. Both acute and chronic codes are reported, with the chronic code sequenced first. Answer, C. Both acute and chronic codes are reported, with the acute code sequenced first. This question tests a fundamental sequencing rule in ICD-10-CM when a patient has both acute and chronic forms of the same condition, and the index or tabular list doesn't provide a combination code. The general guideline states that if separate codes exist for both the acute and chronic conditions, both codes should be reported, and the acute code is sequenced before the chronic code. This highlights that the acute aspect is the more immediate or severe presentation requiring care. Always check the specific conditions guidance in the index and tabular list, but this is the general rule. Question 20. What is the function of the modifier -59? A. Increased procedural services. B. Distinct procedural service. C. Bilateral procedure. D. Professional component. Answer, B. Distinct procedural service. This question asks about the meaning of a common CPT modifier. Modifier -59 is used to indicate that a procedure or service was distinct or independent from other services performed on the same day. This could be because it was performed on a different anatomical site, during a separate encounter, or represents a different procedure altogether, preventing it from being considered bundled. Modifier -22 is for increased procedural services, -50 is for bilateral procedures, and -26 is for the professional component. Understanding when and how to use modifier -59 is crucial for accurate reporting of multiple services. Question 21. A patient is seen for a follow-up appointment after receiving treatment for pneumonia. The pneumonia is resolved. How would the diagnosis be coded? A. The code for pneumonia is reported. B. A code indicating history of pneumonia is reported. C. A code for a follow-up examination is reported. D. No diagnosis code is necessary. Answer, C. A code for a follow-up examination is reported. This question tests coding for follow-up encounters when the original condition has resolved. When a patient is seen for a follow-up after a condition has been treated and is no longer present, the appropriate diagnosis code is typically a Z code indicating a follow-up examination after treatment for a specific condition. The code for the active pneumonia would no longer be appropriate as it has resolved. A history code is used when the condition is no longer active but has potential long-term implications. Z codes capture reasons for encounters that are not active illnesses. Question 22. What is the purpose of the CPT codebook? A. To provide a list of all medical diagnoses. B. To describe medical, surgical, and diagnostic services and procedures. C. To report inpatient hospital procedures. D. To classify diseases and health problems. Answer, B. To describe medical, surgical, and diagnostic services and procedures. This question asks about the primary function of the CPT codebook. CPT, current procedural terminology, is a standardized code set used to report medical, surgical, and diagnostic procedures and services performed by physicians and other healthcare professionals. It is the basis for billing these services. ICD-10-CM lists diagnoses, ICD-10-PCS reports inpatient procedures, and ICD-10-CM is used to classify diseases. CPT is all about the services and procedures rendered to the patient. Question 23. A physician dictates patient has acute on chronic systolic heart failure. How should this be coded in ICD-10-CM? A. I50.20. B. I50.21. C. I50.22. D. I50.23. Answer: C. I50.22. This question tests coding for heart failure with a specific combination of acuity and type. The phrase acute on chronic indicates a worsening of a pre-existing chronic condition. In ICD-10-CM, I50.22 is the specific code for acute on chronic systolic, congestive, heart failure. I50.20 is unspecified systolic failure, I50.21 is acute systolic failure, and I50.23 is acute on chronic diastolic heart failure. Always look for combination codes that precisely match the physician's documentation of intertwined conditions. Question 24. What is the medical term for removal of all or part of a lung? A. Nephrectomy. B. Gastrectomy. C. Pneumonectomy. D. Hysterectomy. Answer: C. Pneumonectomy. This question tests medical terminology related to surgical removal of organs. The suffix ectomy means surgical removal. The root word pneumon/o relates to the lung. Therefore, pneumonectomy means surgical removal of all or part of a lung. Nephrectomy is kidney removal, gastrectomy is stomach removal, and hysterectomy is uterus removal. Breaking down medical terms into root words and suffixes helps you understand their meaning. Question 25. When billing for multiple procedures performed on the same patient during the same encounter, what system is often used by payers to determine payment? A. ICD-10-CM. B. CPT modifiers. C. National Correct Coding Initiative, NCCI, edits. D. HCPCS Level II codes. Answer: C. National Correct Coding Initiative, NCCI, edits. This question introduces the concept of NCCI edits, which are critical for correct coding and billing when multiple procedures are involved. The NCCI edits, developed by CMS, identify procedures that are ordinarily performed together and should not be billed separately, bundled, or specify when certain combinations are allowed with appropriate modifiers. While CPT modifiers are used to bypass edits when appropriate, NCCI edits are the underlying system that determines which codes can be billed together. ICD-10-CM and HCPCS Level II codes report diagnoses and supplies, not the bundling logic between procedures. Understanding NCCI edits helps prevent billing errors and denials.